आलंय ना, recording सुरू झालंय ना? Okay, now I will share this again, right? Yeah. So what I was saying was it would depend upon the type of injury also you have. ठीक है? या काय झालं याला? Okay, so whether it is new compression injury or neurapraxia or whether it is a root avulsion. See, you know what is root avulsion, right? The whole root, if it is avulsed, then that is going to be difficult to, it would be a bad prognosis than just a compression injury. So more than the site of injury, you also will have to look at what type of injury it is to comment on the prognosis. Okay, so there is no fixed rule of 1 + 1 = 2 here. It will depend upon multiple factors. Is that clear? Yes or no? Right?
Yes, ma'am.
So please keep that in mind. Okay. So last time we had seen all different type of birth injuries, correct? So most of the birth injuries, the common cause was what? That if you have breech presentation, right? Or when you have difficult birth or shoulder dystocia, correct? So that is the same reason which is here when for the brachial plexus palsy also. It is due to over traction or that pull on your neck, as in case of shoulder dystocia, or after, you know, head head has come out in case of breech delivery. Okay, still with me?
Yes,
Okay,
ma'am.
Yes,
so
ma'am.
generally this will happen in what? Macrosomnic infant, or those infants who are big, where your head is also big and your body is also big. Your shoulders can get stuck, right? Or your head can get stuck because it is of big size. That may happen. And what happens, that head, you know, that big head is stuck in the pelvic brim, and you are trying to pull the baby out. And त्यावेळेला if there is some excessive force on your shoulder and there is some neck excessive neck flexion or rotation, you might injure the baby's brachial plexus. This is the most common cause for brachial plexus injuries in children. Okay, the another reason may be when there is lateral traction which is exerted on the head and neck during delivery of shoulder, as in case of vertex presentation. Okay, so म्हणजे vertex presentation मध्ये what is going to happen? Your head would come out first, right? And your shoulder is stuck inside, and you try to pull the baby through his head. So what will happen, again there would be excessive force on your these lateral structures, right? Or on your structures on the lateral side of your neck, barabar, where your brachial plexus is going to be there. You all remember where is Erb's point, right? Can someone tell me where is Erb's point? Roll number 2. Do we have roll number 2? Are you all able to hear me?
Yes, ma'am.
हाँ, so roll number 2 नहीं है का आपल्याकडे?
Ma'am, Komal is only roll number 2. Ma'am,
कोणी
hello.
दुसऱ्यानी बोला मग. हाँ.
Ma'am, at the neck region.
Where exactly at the neck region?
Ma'am, ma'am, at the 2 to 3 centimeter above the clavicle.
Right, right. So correct. So when see whatever happens, whether your shoulder is stuck in the pelvic brim or your head is stuck in pelvic brim, distal part la when you try to pull in, there are high chances that that point is going to get under traction, and that is going to be the point where you will have the maximum, that pulling effect leading to some kind of palsy. Now, most of the times, if it is mild traction which is applied, you will just have some amount of swelling, inflammation, something like that, and hence maybe neurapraxia kind of picture. It will completely depend upon how much force was exerted. Okay, just keep that in mind. So generally, this second point now, when there is lateral traction exerted on head and neck, most common type of injury that you will get is Erb's palsy. Are you all still with me? Please keep,
Yes,
please keep speaking, because
Yes, ma'am.
all I'm taking the lecture from my phone. So all I'm I can see here is, you know, the presentation, whatever मी हे जे मिहिरला शेअर केलं होतं तेवढंच. So मला तुम्ही दिसतच नाहीये. Okay, so I don't know who's speaking. So anyone can speak whatever they want to, and you can speak, you know, just keep speaking in between so that I know that you all are still there आणि माझं